oral sedation. I cannot believe, man.
But he did it good.
Yeah, okay, ready. Yeah, go.
Hello, everyone. Today we're going to be talking about something important. That's dental health. It's something that matters to all of us. I'm Fatima Muhammad, and I'm excited to be your host for this live show. We've got a great show lined up. We'll be talking with Dr. Kumar Vadivel, also known as Dr. V. He's a super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry, how to keep your teeth healthy, and ways to get dental care that doesn't cost too much. Whether you know a lot about teeth or just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics, like why brushing your teeth is important and what's new in the dental technology. We've already got some questions from you, our viewers, and we'll answer them. Plus, you can ask more questions during the show. Before we start, let me tell you a little bit more about Dr. V. He's not just any dentist, guys. He's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in the Dallas-Fort Worth area here in Texas. And guess what? He's writing a book that's coming out next year. If you want to know more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable, relaxed, and ready to learn lots of cool stuff about taking care of your teeth. Let's begin our dental live show. Welcome, everyone. And now let's welcome Dr. V and start our show.
Woohoo! Awesome. Happy New Year, all. Happy New Year 2026. And we had a fantastic year, like multiple live shows, and we almost had like one every month. I cannot remember whether we skipped a month or not, but anyway, hi everyone. I'm Dr. Kumar Vadivel, but you guys can call me Dr. V. I'm very excited to be here with you all today again. Let me tell you a little bit about myself. I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bones that support your teeth, and I'm also skilled in dental implants and oral surgery. I am part of the American Academy of Periodontology and the American Board of Periodontology. That's a fancy way of saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialists in the Dallas-Fort Worth area, and we have 4 offices here. And we are all about making sure your teeth and gums are healthy and strong. Now I'm here for you. I would love to hear any questions you might have about your teeth or gums. You can ask your questions live here right now, or even send them for our next show. And your questions help us make these shows really helpful, not just for you, for everyone around the globe. And one more thing, if you like what you see here, and make sure that you let us know. Your feedback is super important to us. And don't forget to subscribe to our channel, and so you don't miss out on our latest and greatest updates and helpful tips for your dental health. I'm looking forward to talking with you and answering your questions, and let's make our smiles as best they can be, right?
Right.
All right. Okay. Let's do it, man. Yeah. Okay.
We have a lot of questions tonight, so we're going to jump right in. Our first question tonight is, Dr. V, what could cause a small hole in my gum below my tooth?
So below the tooth, I'm assuming that you're able to see, like you're thinking that you have the tooth, and then you have below that the tooth, and possibly under the or around the gums, you're seeing a small hole. Usually we see that in what we call it as an abscess or a pus pocket. When you have an abscess, which is a collection of pus, or which is a pus pocket, which is near the tooth crown or on the root, it could indicate an infection reaching the nerve, and you got a lot of infection under the gum line, either because of the nerve, as I said earlier, or it could be around the gum due to the gum disease, and You may have symptoms like pain, swelling, fever, bad breath, bad taste, and all of that. Of course, without telling you, we can't say whether it is because of the nerve issue or because of a gum issue. So contact your dentist, and usually the dentists do like a usual routine exam, and also they do some x-rays to confirm the diagnosis. Immediate treatment could be easier to prevent any type of complications. So they may tell you like whether they need to either prescribe you some antibiotic or they need to do some incision and drainage before the infection gets really bad. Then you may end up losing the tooth. So that's why it is better to prevent any complications of losing the tooth. So the other possibilities that I can think of, what you're describing as a whole, it could be like a small ulcer, which is nothing to worry about. Like sometime it may go away. If you have any symptoms, you can treat that with some type of numbing gel around the ulcer. And some of the modern therapies we do is for even those type of ulcers. If we really believe that it is a small ulcer, it is a laser therapy that we do. Even for some type of abscesses, the pus pocket that I mentioned earlier, we do the laser therapy as well. And if it does not heal, then we may have to go to alternative therapy. But if, let's say, you applied some numbing gel and it just went away and everything is fine and it does not reappear, you may be fine. It may be just an ulcer. But if it continues, then make sure to go see your dentist. Sometimes very hard brushing can irritate your gums, and it could possibly be that. And I call it as a pizza burn. Sometimes people either eat a hot cheesy pizza, then it looks like a hole, or sometimes you eat some really hot cheesy stuff, it just kind of burns your gum. It may look like a hole. Anyway, you need to definitely see your dentist if it progresses or continues, and that will be the best way to treat that.
Those little cheese burns do hurt.
Absolutely, yeah.
Our next question is, I have a job interview coming up. Can a quick smile upgrade still look natural?
Absolutely, yeah. So we call this as like lunch smile lift or lunchtime gum lift, and there are so many things that you could see on the internet. Like they talk about the quick fixes because people have quick interviews coming up, and they have weddings coming up, and or they have to attend some ceremonies or graduation. So we got all sort of things, so you have so many options to make your teeth look kind of natural, and sometimes they could be very, very quick fixes. And like with the modern dental technology, what we have to offer, months ago or years ago, I should say, we need to what we call it as a prep the teeth, meaning like sanding the teeth down, right? It's almost like sanding the wall before you paint. Same way, we sand the teeth down or prep the teeth down, and then we take some measurements of the teeth, like a regular impression, and then we send it to the lab, and then the lab makes the veneers, we call them, or like crowns, and then they send them out. But now with what the technology can offer, we sand the tooth down, and then we have what we call it as an intraoral scanner. So we just kind of scan your entire mouth. It's almost like a camera. If you could imagine, you take a picture of your teeth, but imagine we have a scanner. We have like a wand that we use to scan your teeth. Once it scans your mouth into the computer, and the computer now can feed those images to the local printer that we have, the digital printer, and then those digital printers can spit the veneers out just like that. So absolutely, can the lunch time smile lift, or can you fix it real quickly by going for like a smile upgrade and still look natural? Absolutely, you can do that. So that's one way of doing that. But what are the other quick fix options if you're not really looking for some invasive treatment? Teeth and gum whitening, and that is one great option. but the only limitation is that like you are really looking for some really bright teeth, and the over-the-counter stuff that you can buy, they can only do so much, or even the dentist given whitening or dentist done whitening sometime only can do so much. So set your expectation, and if you are looking for just a little bit of enhancement, not perfection, absolutely, if you're looking for subtle improvements, and definitely you can make it more natural. But again, a quick consultation with the dentist should be able to answer your question to meet your expectation.
Technology has really changed.
Mm-hmm.
It's good, but it changed a lot.
Mm-hmm.
Our next question, guys, is, Doctor, my dental implant abutment broke. Is it possible to repair it, or should I replace it with a new one?
Absolutely. The dental abutments, they don't need to be replaced. Meaning, maybe I should rephrase the answer here. So when you say a dental abutment is broken, you got to be absolutely positive that abutment is broken. I'm wondering whether you're referring to the dental implant is broken. So I'm not really sure. If an abutment is broken, meaning like a completely broken, then I don't think you can repair that. The only way out is to make a new abutment. But if you're saying that when you mean by abutment is broken, if it is just a screw loosening, then absolutely by replacing the screw which is inside the abutment, it is a very quick and easy fix. Sometimes we carry those screws just in the dental office and they are able to put the screw in, you are done. So the abutments are usually made of two materials. One, either they are made of zirconium, which is not uncommon for that to break, and which you may be referring to. If the zirconium broke, then you don't have a way out. So you got to make a new abutment, and then on the top of that goes the new crown, and you got to absolutely make a new abutment on the crown. Although there are some technologies now available, if things have not changed much, the lab can print the exact same abutment the same way as they had it before. Now the dentist is able to use the same exact crown, they can seat it back on. However, if your abutment is made of titanium, then let's say that the bottom part of that abutment is broken, I don't think it can be repaired. And again, just by looking at the abutment or looking at the x-ray or looking at in your mouth, the dentist should be able to tell what type of abutment that you have, what type of implant you have, and whether it is just a screw loosening or the abutment is broken. And depending on the type of abutment, the dentist should be able to recommend what is the best course of action here. So multiple options. With the technology, you got things that you can do faster and better and actually less expensive. And as I said earlier, you can just print an abutment just like this, and it's not going to cost you as much as it used to before.
Do those break from like eating certain things?
Oh, that's a great question. Yeah, right. So zirconium, it's not as strong, particularly for the back teeth, particularly when you make abutments made of zirconium. And normally, I personally do not recommend making zirconium abutments, and I usually make titanium abutments, and then I place a gold hue over on the top of that. But to answer your question, either if it is zirconium and you are putting in a lot of force on the front teeth, where usually we make the zirconium abutments and they can break, and then and the other reason, when even the titanium screws can break because people grind their teeth very hard. And when they have implants on the front teeth, and then they don't have like a lot of back teeth support, just by like eating like a squirrel, like just slamming on the front teeth, you can just break even an implant. Even some people, like I've seen, even they break the whole implant because they keep slamming, or they they grind their teeth so bad.
And you can get a night guard on those?
Absolutely, man. Like you're asking the right, you're on fire today. You're asking the right question. Yeah. Yeah. So if what she is referring to is like if you are a grinder and if you clench or you grind your teeth at night, you can definitely get a night guard to help with that.
Yeah, because those implants cost a lot of money. So I don't want y'all to break them from grinding.
Yeah, so this is a night guard, what she's referring to. So this is not like the one that you get over the counter like this. This is the over the counter one. I don't recommend doing that because when you put them on, the teeth are going to be okay, but you're going to end up scratching your gums away. Then you're going to end up doing a lot of gum damage. But instead, get a custom made one just like this. It just fits on the teeth. It does not scratch your teeth or anything. It just stays on the top. Yeah.
Okay. All right. Our next question is, I'm losing my upper second molar due to decay and it being sideways. Will my gums recede, making an implant impossible?
When you have a tooth rotated, because the tooth is kind of sideways, and because of that, you may see that the gum tissue is slightly higher than the adjacent tooth, which is not uncommon. So if you are going to end up losing the tooth and your gum tissue may end up slightly higher than the adjacent teeth, and that's not going to make the implant impossible at all. Like a lot of times, even when the gums are even, the teeth are even, when we extract it and then we do what we call it as a bone grafting to keep the bone, because some people have like a lot of infection, we cannot place the implant immediately. We can't predict how the bone is going to heal, because if the infection fights with your body and the bone fights with the bone that we put in, you may end up having a little bit of what we call it as an erosion or a resorption of the bone. So that may take your gum slightly above or slightly above the adjacent teeth as compared to your adjacent teeth, which is not uncommon. But you can definitely still get an implant. That's not a problem at all. Although the gum tissue recession may occur, you can still get the implant. Bone loss around the teeth, it's very natural, but it is not going to prevent you from getting an implant. And make sure you talk to your doctor and your dentist about doing possibly adding some gum tissue or definitely doing a bone grafting, so you can definitely get the implant after the extraction is done, and timely action. So do not let the broken teeth just sit like this in the mouth, because you're always thinking, you're overthinking. Make sure that you are going to take the timely action and replacing the tooth, and if necessary get the bone grafting. It can definitely improve the chances of a successful implant placement.
Okay. All right. Dr. V, can my seasonal affective disorder, also known as SAD, medications affect my existing gum disease?
So the seasonal affective disorder, which they are referring to here, it's some kind of like a depression that happens on patient because of the seasonal changes, right?
Oh, yeah.
So which is what happening in Texas now,
yeah.
right?
Yeah.
We were 80 degrees a couple of days ago, and now today we are like on our 40s, and then we are going to go to like 12, right? Like the teens, like over the weekend. In Texas, I don't know whether you know, we got bipolar, even quadruple weather here. So we got sun, and we got rain, and we got cold, and we got all sort of things happening just in one day. There we go. You got it. Yeah, that's the keyword, one day. So quadrupolar weather, right? Yeah. But anyway, so speaking of the depression medication, absolutely, the depression medications can affect your existing gum disease, or even they can create gum disease. So because the medication that you take for your depression or the SAD, like antidepressants, and they can cause dry mouth, which increases the risk of causing gum disease by reducing the saliva and that protect your gums. So that's what causes the gum disease. When the saliva gets reduced, the less saliva can cause more plaque buildup, making it harder for you to manage like your oral hygiene, which is going to make your gum disease worse. And increased inflammation, because you take these medication, some of these medications can contribute to increased gum inflammation, and that will worsen your gum disease also. What do you do to prevent that? That's the key, right? Because you can't afford not to take those medications to affect your health. So you definitely need to be taking those medications. But the things that what you can do to prevent some of that will be to stay hydrated, right? Lots of water, and practice good oral hygiene. And you can buy some over-the-counter mouthwashes to prevent dry mouth. Like there's something called Biotene, Biotene, Biotene mouthwash, or you can look it up online for mouthwashes for dry mouth or toothpaste for dry mouth, and also you can chew on the gum to keep salivating or increase your salivary flow to keep your mouth moist, and or the worst case, talk to your dentist to make sure that if you have any concerns and about the effect of those medications in the mouth, and if really necessary, if this medication is like really making you crazy and like out of the ordinary, your dentist can even talk to your doctor to change the medication if that is a possibility. Absolutely.
Okay. It's time for our live questions, guys.
Oh, wow. Okay, we already, oh man, like already you already see those live questions
yes,
coming.
they already started coming in.
Awesome.
All right, so I'm going to read the first live question we got in for tonight. Can regular use of mouthwash disrupt natural oral bacteria balance? That's a good question.
Yeah, so overusage, right? Yeah. So
I didn't know you can overuse mouthwash.
Yeah. Well, we got like a lot of maniacs, right? Like, they are like maniacs or hypochondriacs, you would say, right? So they are kind of like, like overthinking. Yeah, absolutely. Overusing the mouthwash can disrupt the natural balance of the oral bacteria. If you think about it, right? So these mouthwashes are antibacterial rinses, and the way they work is they go kill certain bacteria, or they control certain type of bacteria, bad bacteria and the good bacteria. So they control the ratio. So if you overuse it, and instead of keeping the good bacteria up and then bad bacteria low, then you're kind of either equalizing it, or you're bringing the good bacteria down also, and the bad bacteria are going to keep growing anyway. So by potentially disrupting that, you are reducing the good bacteria and potentially causing now dry mouth, bad breath, irritation, inflammation. So those all things can disrupt the natural bacteria, and because of the overusage. So we normally recommend using it maybe twice a day, if not not more than 3 or 4 times a day, as long as your dentist has agreed to do that. I normally say after each meal, and or after you brush and floss your teeth in the morning, and after you brush and floss your teeth at night before you go to bed. In between, you can possibly do that maybe once or twice if you're eating snacks, or lunchtime.
Okay, so then I need, because I eat a lot of snacks, so I got a little mini mouthwash, so okay. All right.
Great. Okay.
All right, guys, we're going to get back into the questions. Is it true that sticky desserts like plum cake and toffee can cause gum inflammation?
Absolutely. Looks like we got a lot of questions on the gum inflammation. With us, we were just out of the holidays now. People are concerned about whatever damage they caused to their teeth. That's what I'm thinking here. So definitely sticky desserts, yes, like plum cake or any sticky dessert, like toffee pudding or toffee or even caramel, can cling to your teeth and gums. Sometimes I have a hard time to take them out, like after I eat like a certain toffee and caramel. And by the way, disclaimer, like the truth is like I got a sweet tooth as well. It promotes plaque buildup, absolutely. Plaque buildup, the sugars and stickiness can irritate the gums and leading to inflammation over time, absolutely. And the increased risk is if it is not cleaned properly, the plaque buildup, if it is not cleaned properly, these foods can worsen the gum disease because they cause inflammation, and now the inflammation can lead into to some swelling and some sensitivity and tooth pain and cavities and gum disease and all of that and so on. So what can you do to prevent that? Brushing, flossing after you eat the sticky food. Don't go immediately into the bathroom because you still have the acid on the teeth, and if you immediately brush, then you're going to take a coating off your tooth and you're going to cause more damage. So wait for a few minutes, go into the bathroom and take that extra sticky stuff out of the way to prevent the gum irritation.
Okay. All right. I like this question. Can I place whitening strips over my dental implants, or should I cut the strip and skip those 2 teeth?
So great question, really creative question, right? Like, because people don't even think about it when they apply the teeth, when they apply the whitening, either there it is a strip or some kind of a gel or even a tray, they are applying it all over. So for example, like let's say you have a crown on the front tooth like this. So then what do? You really can't whiten the crown because the crown is made of porcelain or zirconium, and you really cannot whiten them. So matter of fact, you can do some damage to those crowns, meaning like I'm not saying like actual damage to the crown. The crowns may end up losing the just like real glaze or the polish on them whenever you are putting these chemicals on them. So our recommendation normally is to cut the strip around, particularly if you are using it at home, and particularly some of these like strong chemicals that are being sold online, they can totally take the glaze away and sometimes even cause damage to the gum. So be careful, by the way. So by putting those whitening strips, so cut them around the crown, and that way you are not taking the glaze away. And even when we are making it in the office, some of these whitening trays that we send you home with, we cut the crown off, like the crown area off, so you're not putting in the extra gel. Or when you put them on, like do not put the gel, and as long as it is a thick gel, like it does not flow over to the other tooth, if it is not on the crown itself, and you should be okay. This can make the crowns not appear dull, and the teeth are white, and the results definitely could be positive. And if you want to make them like not lose the glaze, and you want them to kind of even, make sure to cut the strip and to avoid any kind of potential issues here.
So skip the crowns, guys. All right. Well, this is a good question because it is sure cold outside.
Yeah.
Does winter dryness cause bad breath, and how can we fix holiday halitosis? That is so funny.
Yeah, that's a great tongue twister, right? Holiday halitosis. Yeah, great tongue twister. So the winter dryness definitely can cause bad breath because it's cold and it's dry air. And these all can lead to dry mouth, which causes to reduce salivary flow. And now, because of the reduced salivary flow, the bacteria are not flushed away. The bacteria release toxins, and I literally say that bacteria pee in your mouth, and they are not flushed away. And when they pee in your mouth, then it causes bad breath. So speaking of the holiday halitosis, holiday foods, particularly the food and the drinks, like coffee and alcohol and sugary treats, lots of sugary treats, definitely can contribute to the bad breath because of all the above said factors, the dry mouth, reduced salivary flow, and all of that. How do you fix it? Definitely stay hydrated, lots of water, lots of water. You can use a humidifier to add some extra moisture whenever you sleep or even inside your house to moisturize the air, and it is going to help a bit. And then definitely keep up with your brushing and flossing. Absolutely, that is the key. But what do you do to prevent? Chewing sugar-free gum. It is going to help, and using a mouthwash. That is going to help. Like we talked about earlier, the dry mouth to prevent the mouthwash to prevent the dry mouth. That's going to really help also. And not only these mouthwashes or the chewing gums are going to prevent, but also they are going to help you freshen your breath because you mentioned about the halitosis, which is a bad breath. So now they are going to help with that also.
Okay. So what he said, guys, look, to fix the holiday halitosis.
You got it.
That is so funny. I just like how they say that.
Yeah.
It's my favorite part of the show.
What is that?
The rapid fire questions.
Oh, okay. Oh, we already down there.
Yes.
Okay, got it.
I like this part of the show because you can't take too long answering the questions, okay? So we have 5 questions.
Okay.
I'm going to start from 5 and work my way up to 1.
Okay.
But you can't take too long to answer them, okay?
Okay.
All right. So the first one. If you weren't a dentist, what would you have pursued instead?
Possibly a software engineer, I'm thinking. Yeah.
Okay. That's a good answer. That's still a good field, too.
Okay.
All right. Next one is it okay to give an electric toothbrush as a New Year gift for my 6-year-old grandson?
Absolutely. An electric toothbrush is a great gift. It's a great Kickstarter for your 6-year-old grandson. There are some of them, like they are exclusively designed for the kids, sometimes with fun features and, softer bristles and the size that fits the children's mouth and help with the sensitive gums. And you can look them up online, and there are plenty of gifts available. Absolutely.
I might need to give my son one for his birthday.
How old is he?
He'll be 11 in April.
Okay, got it. Okay.
And brushing he hates it. So I may get him an electric one.
Get the one with the gadgets on him, like with the smartphone, so he can attach it to.
Oh yeah, because he loves his phone, so
Yeah,
that might work. I need to look into that.
Absolutely, yeah.
All right. Is it safe to frequently use whitening strips during the holiday season before photos and parties?
Yeah, it is definitely safe. Using whitening strips occasionally is definitely safe, and it's not a problem at all. But overusing them can lead to sensitivity and gum irritation and all of that. Instead, maybe consider doing a professional whitening right before the holiday season starts, and that way you can occasionally do the whitening, home whitening at home occasionally, and which may be a little gentler as compared to doing it or overusing it.
Okay. Which is better for cleaning the tongue, a tongue cleaner or a toothbrush?
Either. I would say a tongue cleaner sometimes goes a little bit harder because you put your tongue out and then you clean it like really like it's hard actually, like you can scrape it really bad or you can scrape it really hard, as opposed to a toothbrush and you can only do so much. It's just a matter of cleaning it. What I normally recommend is try to clean it with the toothbrush, and if the tongue looks clean and you're good to go. If you're not able to, then buy a tongue cleaner. Yeah.
Okay. All right. Last one. Should I brush my gums?
Absolutely. The answer is yes. And so normally when I tell my patients, you don't just brush the teeth, you brush the teeth and the gums. So go around the gum area, which is where you're doing the brushing, and then on the tooth is where you're doing the brushing. That's going to help remove the plaque and the bacteria, promote the teeth health as well as the gum health.
You did good. You answered them and
Awesome.
you did really good.
Awesome.
All right, we're going to get back into the regular questions. All right, doctor, I take good care of my teeth, but black spots keep returning. How can I stop this permanently?
So you can't really completely 100% stop it, because sometimes it is just you. That's the way, like, you were engineered, you were born and you grew up. Because these types of stains, we call them as what we call it as an extrinsic stains, meaning they are outside on the tooth, and these are caused by sometimes specific type of like bacteria that create like sometime like kind of what we call it as an insoluble chemicals or like some iron compounds, and these type of the compounds are the ones that are really causing these stains. So when these stains are commonly seen, we see like most of the time like on children and some adults, although the exact cause, we really don't know the reason why, although we know it is because of the altered bacterial activity. However, one positive thing that we know is we see the cavity risk on these people are slightly lower as compared to the people where they don't have this stain. We feel that it may be because they have a little bit of a good bacteria, or like a good bacteria are slightly higher as compared to the lower. So when these good bacteria are higher, they are good for keeping the health of your teeth, but at the same time they cause some kind of stains around the teeth. But sometimes we also see that the stains could be due to some of the supplements you could be taking, mostly due to like the iron supplements, and sometimes it could be due to some kind of a seasonal changes, or some maybe because of a specific food that you eat, and the food causes some altered pH in your mouth, and because of the altered pH now that causes some type of stains. Or as I said earlier, it is just the way your genetics, your genetics, and you got it whatever from your parents, and that's what like causing these extrinsic stains or the stains on your teeth. So the best treatment for that is, of course, what we call it as this polishing or scaling and polishing after you go to the dentist. And I'm sure you probably like experience that they use what we call it as a rubber cup to go around the tooth, on the tooth, to polish it, and that's the best way to get rid of that or keep that from reoccurring very soon. And then some of the newer approaches now we have seen is people are taking probiotics, and they call them prebiotics or probiotics. And then because these type of these medications, these are all over the counter, by the way, because they alter the type of bacteria that you have in the mouth or in your whole system, and they may be rebalancing these type of the bacterial loads to prevent these stains from happening. Again, there is no absolutely proven research that has been proven, but it's something that you may want to talk to your doctor about, then see whether any of those can prevent. And you can even talk to your dentist. And prebiotics or probiotics are like, sometimes it may not cause any harm because they are over the counter stuff, but again, something to watch for and talk to your doctor and dentist about to reduce particularly to recurrence of these stains, so they don't keep recurring over and over. Yeah, particularly for that.
Can the stains come from food and stuff too, and be?
Man, good question. Man, I was thinking when I was answering, and I was going to say, so watch the food you eat. Absolutely, yeah. So some of the foods that you eat, that can cause some stain also. Yeah, lots of colored, stuff that you get over the, on the food. Some of these food stains, can be like easily preventable if you can
Yeah.
avoid those food. Yeah.
And if you brush after you eat those colorful foods, that could help too. But I'm learning a lot of stuff is like hereditary too. I didn't know that teeth was hereditary. Like, I didn't know you can get some things like that your parents or grandparents had problems with their teeth. I'm learning that.
So not just the stains, we just mentioned
Yeah.
just the stains, right? But the cavities, because your grandparents or your mom or dad were prone for cavities, and because you're genetically kind of similar to them, so the type of bacteria that you have, right, and that is kind of similar to them, so that's the reason why you're more prone. And the same thing happens with gum disease also.
Oh wow.
And people say, I'm sure you probably heard, in your practice, my mom and dad, they lost their
Yeah.
teeth at a young age.
I hear
Partly
that a
because,
lot.
the genetic makeup of them, right?
Yeah.
But what I normally say that because people always use it as an excuse because they don't want to brush and floss. But what I normally tell them is, of course you are at a higher risk of losing your teeth because of, the genetic, your genetics. And but the way to prevent that is, for example, this is a typical story I tell them. Hey, your mom and dad had high blood pressure, diabetes, and maybe one of them died at a young age. But you don't have to be afraid, it is going to happen to you. But if you lead a healthy lifestyle, if you work out, and if you watch your diet, if you go to the doctor regularly, and you do all the prevention you can, you definitely have a higher probability of getting that. But you can avoid all of that because you are leading a healthy lifestyle. Same way, you may be at a higher risk of getting a cavity, or you may be at a higher risk of getting gum disease because your mom and dad had it or your grandparents had it. But now, if you're going to brush and floss your teeth on a regular basis, use the right mouthwash, use a lot of other oral hygiene aids like water pick, and go to the dentist regularly without skipping the visits like every 3 to 6 months, you absolutely can prevent a lot of those stuff.
Yeah. And you don't have to do everything and get everything from your parents. Just look,
And did
be
he say-
better than your parents.
And did he say that don't blame it on the mom or dad?
Don't blame it on the mom and dad.
That's what I say. Hey, don't try to blame it on the mom or dad.
Don't.
You do your part.
Yeah. Long as
The
you do
accountability
your part.
comes from you. Right.
That's right.
Absolutely, yeah.
We got some more live questions coming in, guys.
Okay.
All right. It says, my son's teeth chatter a lot. Could this be due to cold weather, or is it a sign of a dental problem?
So, the teeth chattering, it's, people do that, right? When you're in a
When
cold
I'm
weather.
cold
Yeah, when
and
you're
shivering.
cold. You do that, right? So the teeth chattering, it's often like a natural process because that's the way you kind of keep yourself warm, right? Because as the body tries to keep yourself warm, but it happens, if it is happening frequently, even indoors or outside or in colder condition, it could be a sign of a dental or a jaw issue because your jaw is supposed to be when you're relaxed, and they're supposed to be away like that. But when you keep them together, when you're grinding or when your muscles are kind of so tight, you keep them together. But now if you chatter, then now you're going to end up putting a lot more pressure than what you should. Now, and because of that, now you're going to grind, or you're going to pretty much sometime even kind of break your teeth, if you keep doing that a lot. So it is a very good idea to keep monitoring that, and if there are any other symptoms other than just a little bit of chattering that is happening, and consult with your dentist. And if you're concerned, if you feel like, hey, there is something not right, absolutely go to your dentist and look for any underlying cause, whether you have any kind of a teeth positioning issue, or it could be an early jaw issue. So you definitely should be talking to your dentist about that. for any underlying dental problems or maybe like a jaw problem as well.
Especially if he's doing it and it's not cold.
Yeah, definitely. You're absolutely right. Yeah.
If
So if it is not cold and if they are doing it, yeah, definitely just take them to the dentist. Yeah.
Yes. All right. All right. That was a good live question. Thank you for your question.
Thank you. Thank you guys. Yeah.
All right. Our next question is the HPV vaccine safe and effective for preventing oral cancer? At what age should I or my child get the HPV vaccine?
So the HPV vaccine, I'm not a doctor. I do have, although I don't have the proper qualifications to answer this question, because normally the HPV vaccine is given by a doctor, not a dentist. But with my experience and working with a lot of my medical colleagues, what I know is the HPV vaccine is very safe and it's very effective in preventing high-risk HPV infections, definitely which are linked to oral cancers and particularly like a throat or the tongue cancers or even tonsil cancers. So definitely it is very effective. Speaking of the HPV and the oral cancer, HPV is now stated as the leading cause of oropharyngeal cancers, and vaccination for HPV is going to definitely significantly lower your risk of developing these cancers. That's for sure. Safety, right? The vaccine is definitely well researched and safe, and that's what like we believe as a medical community. With mild side effects, like which is very common from any type of vaccine that you can think of, such as soreness, fever, and headaches, which is like very common with any of the vaccine. And normally the age, this is kind of like a debate that we used to have. So HPV is common, only that happens most of the time it because of the oral sex. So what it used to be like, in the past, like people were putting an age to it, like 16, 18, 20, 25 and all of that. But now we say the kids are now becoming sexually active, as low as like about 11 or 12 years now. So now what we normally say is the right age to do the vaccine is when they become sexually active, because that's when they are going to get engaged in oral cancer, and that's when they are going to be exposed to these HPV virus because of the oral sex. So talk to your doctor, and more than anything else, talk to your kids and know your kids better, and to see whether they are going to become sexually active. So, and you can vaccinate them before they become sexually active. And why does it matter? Because early vaccination before they become sexually active provides better protection against these HPV related cancers, including oral cancer. So again, talk to your kids, talk to your healthcare providers to discuss the best vaccination schedule for your child.
And talk to your child too.
Absolutely, yes.
We have one more live question, guys.
Mm-hmm.
I'm going to read this one. Doctor, this is a good one. Doctor, who has better oral health, men or women?
Oh, man.
Us.
Well, you know that, right? Yeah.
I'll just take it a guess.
Yeah. So overall, research shows that women have better oral health than men, and studies show that women are more likely to visit the dentist regularly. They maintain better brushing and flossing habits, and just like your makeup stuff, man, right? Yeah. And have healthier gums also. However, the hormonal changes during pregnancy or menopause and menstruation can affect women's oral health, but women are generally more proactive about taking care of them and preventive care particularly. Men, on the other hand, and they are just likely to visit the dentist unless the woman is kicking butts, right?
Yeah.
And often have higher rates of gum disease and tooth loss. And however, maintaining good oral health is ultimately the result of personal habits and like brushing, flossing, and smoking, and genetics even too, and regardless of the gender. Yeah.
And I agree. Pregnancy, I did not know it takes a toll on your oral health.
Absolutely, yeah. So we had. So what were you thinking when you said that?
Because like I didn't know that. I mean, I know like the baby takes all the vitamins, but I never thought like it would affect my mouth. I mean, because you take the prenatal vitamins, but that's for like the baby and stuff.
Right.
That doesn't help with like the oral health and stuff. But like they have vitamins now that, and like I think they said my calcium was low and it was due to and it was affecting my teeth. And I'm like, he's like, yeah, it's like it strengthens your bones and your teeth is like a bone, and it got real soft and it like actually broke. And he was like, the baby's taking everything from you. But I didn't know that until I had my fourth child. I never had any tooth problems. And when you're pregnant, it's like when you have a toothache, it's like 10 times worse when you're pregnant.
Absolutely.
And they start coming out of nowhere when you're pregnant.
So what Fatima is trying to say here is, of course, you need the extra nutrients because the baby is going to consume a lot of these nutrients, and you're concerned about the baby, and sometimes you're on prenatal vitamins and all of that. Still, it just may not be enough. One of the biggest challenges that we have is because of all of these hormonal changes, and your blood flow is going to be crazy because the baby is going to consume like a lot of blood also. And because of that, there is a lot of blood flow that's coming into your mouth. But even the slightest plaque can cause like an exaggerated inflammation around the mouth because of the increased blood flow. And because of that, the moment you touch, like the gums are going to start to bleed like crazy. And the biggest challenge is, and if you are not like a regular dental visitor, then you already have some existing plaque or maybe existing tartar. Imagine like a sliver getting stuck under the skin, but imagine a sliver getting stuck under the red skin. How bad it is going to hurt compared to a regular skin versus an inflamed skin. That's the same way. When you have tartar now get stuck under when you're pregnant on the inflamed gum tissue, it is going to hurt like hell.
It is going to hurt.
Yeah, absolutely.
It's like your mouth get extra sensitive when you're pregnant.
Absolutely, yes, yeah. Particularly the mouth gets extra sensitive.
Yeah.
It is absolutely true. Yeah.
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 That is all our live questions. Thank y'all for y'all live questions.
Thank you
I
again.
enjoy those live questions.
Absolutely. Thank you for making, keeping us live here. Absolutely.
Yes.
And let me see whether we have any other while you're reading the next question, okay?
Dr. Vadivel, is it better to schedule gum surgery during winter break or summer break?
So it is definitely to do it at the right time, whether it is winter or summer. So it doesn't matter a whole lot. You got to follow the recommendation of the periodontist or the dentist. If you are looking to do this during your winter vacation, like pros are you could be less socializing, giving you time to rest and recover. And the challenges are, the dry air can make your healing a little bit slower. Sometimes cold weather might affect your healing or the discomfort, or it may cause more discomfort, but not a whole lot. I do the surgeries, all the time, like every time. I don't even think about it, and I'm sure I'm going to say you're overthinking when to do it. I don't think it is going to matter a lot. But if you're thinking about doing it during summertime, it's just warmer weather, easier to keep hydrated and comfortable. You're going to be drinking a lot of water anyway. and the challenges would be again more social events and potentially making it harder to rest properly. Like if you're doing a lot of social events and you're going to be camping and stuff, and you can't do like you can't have like a proper recovery. But consider just any time is a good time, and make sure that you are going to rest well, keep yourself hydrated, and make sure that you are going to follow the aftercare instructions given by the dentist, which is the key, and for the best healing experience.
Yeah. I would just take some time off.
Absolutely. Yeah, well, if you have the luxury of taking the time off, talk to the dentist, and then they will recommend what is the right amount of time that you got to take off, and then they'll be glad to give you a note. And if work allows you some time, and so if you can take a sick day here and there, then definitely talk to the dentist, and they can give you a note to take to work, or like even school, like if you're getting procedures done for your kids.
Oh yeah. All right, what would a bite plate do to help TMD/TMJ issues? I'm getting one soon, but I don't know how it's going to work.
So what they call it as a bite plane, before we go into that, TMD or TMJ, meaning we call it as a temporomandibular joint or temporomandibular joint disorder. So that's what is the TMD or the TMJ stands for. So what we are referring to is what we call it as an anterior bite plane, or a plane or a splint, which is like a small little thing that we put in the front of the teeth, just here. Either they put it on the top, or some people do it on the bottom, and that kind of helps reposition your jaw in the jaw joint here. We call it as a ball and a socket joint. So the bottom jaw moves like this. Imagine this is in the skull bone here, and the jaw kind of opens and closes like this, and this is what we call it as a ball and socket joint. So whenever that happens, it puts the jaw back into the socket when you particularly have difficulty in opening or closing your mouth, and when you have a clicking or like a crackling sound or a fracking sound that happens in the jaw, and it helps you relax so it does not make those funny noises. And also to help you your bite kind of becomes stable, and it positions your jaw kind of stable, and it helps improve the muscle function and the blood flow, and gives like a little bit of balance, because you tend to lose your balance when you bite too much. Okay, and it'll also help prevent any type of pain, prevent any type of tension that you may get on the muscles. That's what it is going to help with. And it is also going to prevent those teeth from coming together, because now you got a bite plane, and now because you're not bringing those teeth together, you're not going to put as much of stress or as much of pressure on the muscles back here, which is going to help distribute the forces all over, as opposed to just some of those teeth or some of those muscles. So that's like it definitely the way it works. And would I recommend getting one? Absolutely. If you are a candidate and if you have experienced any type of TMD or TMJ issues, talk to your dentist, and they will be able to evaluate and tell you what is going to work for you and give you the best solution.
Every time I hear TMJ or TMD, I just get so nervous for people, because I'm like, it just sounds like it hurts back here.
Yeah.
And like I've even heard like when people open their mouth, it like cracks a little bit.
Oh
almost.
yeah. You people, like sometimes you can hear like maybe even across, like some one of the most common things that I hear is, hey, I can't go out for lunch or dinner with my friends, because anytime I open my mouth, it just like they hear even the cracking. It's very annoying, and they can't think of going on a date night.
Yeah,
Man, that's what people are very, very afraid of. Yeah, more than going out with the friends. You know, they would
yeah.
understand. But going on a date night with a stranger, right?
They
That
wouldn't
would
get
be
a second date. I mean, they would probably have to explain.
What did you say?
They wouldn't get a
They
second
wouldn't get a second date. Okay, gotcha.
Because if you're talking and I just hear click, clack, click, that's all I'm going to be focused on.
Oh,
so
man.
I'm forget I'm on a date. I'm just, what is that noise?
Yeah, right.
But
I think we are time here. I think, yeah.
yes, we have reached our time, guys.
Yeah.
I enjoy speaking with you guys, answering all your questions. We will see you next time. Bye.
Thank you all. See you next time. Okay, take care. Bye. Yeah, bye. Yeah, I think you disconnected. Yeah, perfect.